Good afternoon, everyone. Thank you for giving me the opportunity to share a little bit of what is happening in Mauritius. So I'm Elodie, working for the leading organization on HIV and AIDS in Mauritius, which is PILS. And we also focus on hepatitis C because it's with the population that we work with, people who inject drugs, they are also living with hepatitis C. I focus on three aspects of the work that we are doing at our organization, and it's mainly community outreach. The first one is community testing, rapid testing, that are provided to hidden population like sex workers, MSM, and people who inject drugs. And these tests are done by outreach workers and peer educators, which comes from the community itself, people who inject drugs. And then following the rapid testing, those whose tests are reactive, they are linked to care. For information, so the treatment is available at the hospital, but people who inject drugs, they are denied those treatments because people talk, because they talk about reinfection, so every time they go to the treatment, they are denied access to treatment. And this is where we came with another program which is called the Community Health Advocate, which consists of training community leaders and peer educators for themselves to advocate for their rights. When we began the project, we realized that people who live with hepatitis C, they didn't have any information about the virus, about the health complications that came with the disease. So there was awareness sessions, and the community health advocate also led negotiation with a research lab working in Mauritius for genotyping and viral tests free of charge, because this is not taken into account by our Ministry of Health. So we were able to negotiate for people to get those tests done free of charge, and then they were linked to the hospital. And another aspect of the work of the community health advocate was to do the close follow-up with the patient, because like I said, people who inject drugs were denied access to treatment. When they go to the hospital, doctors will just say, no, you can get access, or we don't have treatment. So we really wanted to document all the barriers that people were having to actually get access to those treatments in order to better advocate with our ministers to facilitate this access. And to finish, what is currently happening in Mauritius, so our organization with other partners organizations are actively advocating for access to treatment for all. We had an EPSI conference last year with different ministers, Ministry of Health, doctors, nurses, and organizations. And this conference was really, we have experts from other countries, including Egypt, UK, who came to give recommendations about a national plan for the elimination of hepatitis C until 2025. And one of those recommendations was to put up a national committee for a response for elimination of hepatitis C. This committee has not been put in place yet because we have upcoming elections, so it's taking a lot of time, but hopefully this will happen. Another thing is we had the financial support of Gilead, who is going a micro test in Mauritius, where we are having treatment, and they're going to treat about 5,000 patients. It's pan-genotypic treatment that is not available for the moment, and this will come in November 2000. It's this November. Sorry, it's this November. And our goal will be to make sure that our patients get access to this treatment and that they are not discriminated. And we are also advocating for fast tracking of our patients, because for those that we have been following through the process to get treatment, from the first appointment to when he meets the specialist and get the treatment, it takes about 6 months. So we are in negotiation with the Ministry of Health to fast track our patients, and also as we will have the pan-genotypic treatment, in order to make it more in outreach and that more people get access to the treatment, we are negotiating with them for being able to give the treatment at our organization and other organizations working with people who inject drugs. And we are in the current drafting of Hep C and a protocol for Hep C treatment in line with the pangenotypic treatment that are coming soon. Thank you.